Dooley Noted, 5/22/2016. Hi, I'm Dr. Kathy Dooley. I'm here in Catalyst Sport to review a couple of drills people have been talking to me about wanting to encourage their hips to open up during the bottom phase of the squat. You may see a lot of your clients or patients with knees that are caving in. We call this valgus collapse. A lot of times it's a match of core stability problems, the ability to be able to hold oneself over the center of mass, and being able to maintain the hips in an externally rotated position because they're losing intrinsic abdominal control. As you can see from the side, the bottom phase of the squat, you want to be able to maintain your lumbar lordosis without excessively creating it by leaning forward and without tucking the pelvis under. So to be able to maintain this upright position, we look for the ear to be over the acromion, to be over the knee, to be over the ankle. And people struggle with this position. To be able to maintain that from the front, you want to be able to slightly be able to move the feet out at about no more than 15 degrees and be able to pull into that position as well. This takes strength in an external rotational range as well as the core stability to open up the hips. For my females and some males that have the pelvic floor insufficiencies or pelvic floor dysfunction even, they may really struggle with this component of being able to open up the hips without tucking the pelvis underneath. Other people may compensate with knee discomfort by pushing too much weight into the forefoot. So I've matched a couple of drills to help you with this, to encourage your hips to not only externally rotate, to maintain that position in the bottom part of the squat, but to also be able to add in some core stability that you need to be able to hold yourself upright. This is something the baby does very well, only they have a third of their weight in their head, so it's a little easier for them to get their buttocks back. For the adult, it's a little bit more challenging. So one thing you can do from the very start is to be able to monitor your foot position. For this straightforward foot, it might be challenging for some. You may want to just bring that out just a little bit. Don't excessively do it because you'll actually limit your ability to be able to fully enter the hips. You want to be able to move into about 10 to 15 degrees of movement outwards into the foot. Now you want to dial the foot in to make sure the great toe, the fifth toe, and the heel are positioned into the ground. And as you're descending, you have to be able to move and maintain this big belly full of pressure, but be able to open up the hips. Most people have their breathing off on this. You can practice getting a big belly full of air, a big inhale, where the shoulders actually kind of drop a little bit and you're getting 360 push out, maintaining that inhale as you descend, and then pulling yourself back up in a controlled exhale. Rather than letting out all of your air, you want to really control that exhale so that you don't lose the tension in this balloon that is intra-abdominal pressure building in the abdomen. So again, you want to maintain your inhale, descend, and then exhale as you ascend. For people that struggle with that, and especially at the bottom part of the squat where they may tuck the pelvis under or tilt too far forward, we give them the drill with a kettlebell. For the weight, you just pick a comfortable weight and you descend to the bottom part, and you want to actually shift the bell forward as you shift yourself upright, and you rock back and forth to practice this action, like so. From the side, you'll see that as I shift my weight into the heel, I'm able to access more of an upright position. For people that are tilting forward, they'll find this very, very challenging. You may have to hold a sustained inhale on that particular drill. Once you get really solid on that, then you can work on the bottom part of the squat with a hip prying motion. What you do for this is you start your initial drill of the rock back, but now you're keeping your knees in between your femoral condyles, the inside of your knees, and you're trying to pry the hips open. And you're sustaining a controlled exhale. What this will do is not only coordinate pelvic floor movement with the hip, which permits external rotation, but it will also maintain abdominal stability to be able to hold yourself ear to acromion to knee to ankle. That nice inline posture that you see where you're able to maintain your normal spinal curves, but not excessively go into lumbar kyphosis or lordosis, or otherwise excessive curvation here or underneath. So thinking about these major points, the spine really shouldn't move During the squat, if it's allowed to move, the hips may lock up to try to protect you. This is the nature of valgus collapse, when people lack that external rotational strength because they don't have the abdominal stability to support it. For my pelvic floor patients, the breathing's a little different for you. You'll inhale, pull up and out on the pelvis, and then come down. Letting the pelvis relax a little bit more as you ascend. So for the pelvic floor coordination, just a little bit more challenging for people with incontinence. So if you're getting incontinence on the way up from the squat, you may not be pulling up and out enough on the pelvis. The Kegel cue, a little bit of a challenge, right? Because you don't want to hold a Kegel the entire time that you're doing exercise. The pelvic floor actually tightens up and out during inhalation to support the pelvic viscera. So make sure that you're a little bit more clean with your breathing cues when you're doing the squat for a pelvic floor patient. This is Dr. Kathy Dooley. I hope these two drills help. The rock back along with the hip pry may encourage you to be able to open up the knees over the great toe to be able to maintain that external rotation, as well as train the pelvic floor to coordinate with the abdomen so that you can not only strengthen your squat and external rotation of the hips, but also to be able to limit that valgus collapse, that knee collapsing inwards that you see in a lot of people. Dr. Kathy Dooley, I'll see you next time.